Welcome to Essentials of Pharmacology for Health Profession, 9th edition, Chapter 16, Gastrointestinal Drugs. Upon completion of this chapter, you should be able to describe the uses, side effects, cautions, and contraindications, interactions of acid, anti-ulcer agents, and agents for gastroesophageal reflux disease, which is your GERD, agents for irritable bowel syndrome, antidiarrheal agents, antiflagellants,
cathartics,
and laxatives, and your antiemetics. You should be able to understand the 7 types of laxative according to its use, side effects, cautions, and contraindications, along with the interactions. You should also be able to identify the examples of drugs from each of the 8 categories of the GI drugs, explain important patient education for each category of the GI drug, as well as be able to differentiate the causes and treatment for the H. pylori and the C. diff infections. Okay, so we're going to look at the GI categories, or your gastrointestinal categories. There are 8 categories based on the mechanism of action for the GI drugs. You are looking at 8 of them that is on your screen. Your antacid, treatment for ulcers and GERD. Your GI antispasmodics. Your agents for your IBD. Your antidiarrheal agents, antiflagellants. Your laxatives and your cathartics. And antiemetics. Okay, so these are the GI categories and their drugs. If you look, what you're looking at is it just tells you that there are 8 categories. You can look at the GI drug category along with the medication that falls under that. Please pause the video and take a minute and look over and get familiar with the medications. Okay. Our antacid agents, they work against excessive acts of production to produce harmful effects. Antacids act by particularly neutralizing gastric hydrochloric acid and are widely available in many over-the-counter preparations for the relief of indigestion, heartburn, and stomach or sour stomach. Antacids can either increase or decrease the absorption of other medications. Because they can decrease the effectiveness of the drug, antacids should not be taken within 2 hours of administering the following medications that you see on the screen. Anti-infectives like your tetracycline, your quinones, your isoniazid, and the following medications that come after that. Make sure you read the side effects that you're seeing on the screen, your cautions and contraindications, and interactions that it can have with the other medications. We also have patient education. How are we going to educate our patients on these medications? As we're getting in our gastroesophageal reflux disease and anti-ulcer agents, your H2 blockers is one. The histamine receptors found in the stomach are called H2 receptors. Your H2 receptors antagonists reduce gastric acid secretion by acting as histamine 2 blockers. They also reduce the amount of gastric acid released in response to stimuli such as food and caffeine. A new combination medication, your Duexis, which consists of your famotidine and ibuprofen, is approved for the treatment of arthritis and rheumatoid arthritis. Because the ibuprofen and other NSAIDs can cause stomach ulcers, the famotidine H2 blocker acts as a protectant. Look at your side effects that you can see on the screen, your caution and contraindications, and look at the list of medications that can interact with it. Also, there is a side note, and it's very, very important that you know this. There is less likelihood for drug interactions with Pepsid. As gastroesophageal reflux disease is shortened for GERD, is caused by the excessive reflux of gastric or acid gastric contents into the esophagus, resulting in irritation or injury to the esophageal mucosa, characterized by heartburn, and acid regurgitation. Your Prilosec is a gastric anti-secretory agent, which is considered your PPI, like protein pump inhibitor, and it is unrelated to your H2 receptor antagonist. Look at your side effects. Look at everything that can happen. Also pay attention to, like, in patients older than 50 years, long-term PPI therapy, at least 1 year, particularly at high doses, is also associated with an increased risk of hip, wrist, or spine fractures. A potential mechanism for this is the PPI's interference with calcium absorption. Also look at your interactions that you can see on the screen, the medications. Make sure you read the clinical application to find out what is the difference between the gastric versus the duodenal ulcer. And what did you learn from reading the learning hint box? We're going to begin talking about our gastric mucosa agents. Your misoprostol is a synthetic form of the
Prostaglandins.
E1, and inhibits the gastric acid secretion, protects the mucosa from the irritant effect of certain drugs, for example, like your NSAIDs, especially those that are at risk, your patients that are debilitated patients, older patients, or those that has a history of gastric ulcers. Proactively, it is approved to prevent NSAID-induced ulcers and can be used off-label to treat gastric ulcers when patients are unable to take medication. It is also commonly used during pregnancy to induce labor, or it can also be used to terminate pregnancy. Look at your side effects that it can have. Make sure we look at the cautions or contraindication in women of childbearing age, and like especially children under 12. Look at your interactions, what it can do. Our next one is our saccharate, which is an inhibitor. Pepsin it is another anti-ulcer agent that acts in a different way. Saccharate is administered on an empty stomach and then reacts with hydrochloric acid in the stomach to form a paste that adheres to the mucosa, hence protecting the ulcer from irritation. The therapeutic effects of the drug result from the local rather than systemic activity. Look at your side effects, which is rare. There's hardly any. And an acid may decrease binding of the saccharate to the mucosa. And then look at your interactions. What are some of those things that we should take a look at? Helicobacter pylori bacterial infection plays a major role in the development of gastritis, gastric and duodenal ulcerations, and gastric cancer. Your H. pylori, which is shortened for the Helicobacter pylori, has been treated successfully with multiple drug regimens, normally over 14 days. The treatment and possible side effects are going to be discussed later in chapter 25. Okay, so what we're going to talk about now is the gastroesophageal reflux disease and anti-ulcer agents. In this particular, what you're looking at is a pepsid ulcer. On the far left, it shows us the damage that the H. pylori does, and on the far right, it's showing us how the acid is passing through the weakened mucus layer, and it's causing an ulcer. You see how much more damage it is there? Alright, let's take a look at the case study. We have a case study activity. A 14-year-old patient presents to the physician for continual stomach irritation. Upon further testing, the physician notes that there is patchy inflammation through the small and large bowel. The physician diagnoses the patient with what? Look at your choices, write down your answers, and we're going to check it at the end of the video. Okay, so we are now in GI antispasmodics and or
Anticholinergics.
okay. We are
Dicyclamine.
is an antispasmodic or
Anticholinergics.
what they do is to help calm down the bowel. The Bentyl, which is a
Anticholinergics.
and an antimuscarinic agent, which is used to treat the IBS and any other functional disturbances of GI motility. The GI
Anticholinergics.
Work by decreasing motility, which is the smooth muscle tone in the GI tract. Your side effects, especially in your older adults, can include the items that you see on the screen: dry mouth, constipation, blurred vision, and many more that you see. Your cautions or your contraindications can include like glaucoma, unstable cardiac disease, obstructive GI disease, and your ulcerative colitis, obstructive uropathy, and myasthenia gravis, and lactation. Your interactions with the medications, as you see on the screen. What you are looking at is an irritable bowel syndrome. The image shows constipation. You can have the area where the spasms happen. You also see the area with the extended bowel, and then you can see at the very bottom where you have diarrhea. But if you look, it lets you know that on the ascending or the upper part of the colon, that's what the constipation always happens, and the diarrhea occurs mostly on the descending or the lower part of the colon. Okay, we're going to look at the irritable bowel syndrome a little bit more closely. We're going to talk about the Crohn's disease and the ulcerative colitis. Your Crohn's disease, if you're looking at your screen, is demonstrating patchy inflammation throughout the small and the large bowel. So it's all over. And in comparison with your ulcerative colitis, it is located in the large bowel, but you notice that it is continuous and it's uniform inflammation. So that's the difference between the Crohn's and the ulcerative. The Crohn's is scattered and the ulcerative is uniform. Alright, so we're going to take a look at the inflammatory bowel disease. Your IBD is a chronic condition that causes inflammation in the lining of the GI tract, and that includes Crohn's disease and ulcerative colitis. One of the main clinical features of this condition is abnormal defecation, which may be predominantly constipation or diarrhea, so it can go back and forth. And sadly, there is no cure for IBD. We're going to talk about this medication,
Mesalamine.
and the prodrug,
sulfasalazine.
They have a chemical structure similar to that of aspirin and exhibit anti-inflammatory activity in the GI tract. They are used in the management of Crohn's disease and ulcerative colitis. These salicylates are also designed to reach the ileum and the colon, which helps bypassing the stomach and upper intestines. They are safe for long-term use and are well tolerated in most patients. Look at your side effects that you see on the screen, your cautions and contraindications, and look at the interactions with the other medications. We're going to talk a little bit about glucosteroids, and just a little bit about them. They are used to treat moderate to severe active forms of IBD in patients who are inadequately controlled with salicylates. The oral steroids do not require direct contact with the inflamed intestinal tissue to be effective to help. Our monoclonal antibodies can be used to treat refractory and severe cases of Crohn's disease and other forms of IBD. Patients taking these medications are at higher risk of infection and should not receive live vaccines. These medications are administered via subcutaneous injections or IV. Look at your side effects, what they can do, and cautions and contraindications. Let's look at your GC-C agonist,
Linaclotide.
which is your Linzess. Is a fairly new medication that's indicated for IBD with severe constipation. It is a once daily oral capsule that works by activating your GC-C receptors on the inside of the epithelial lining. This causes an increase in fluid secretion and therefore an increase in bowel motility. There are just a few things for your side effects, and to look at your cautions and contraindications. Alright, so we're going to turn and change to another agent, which is your antidiarrheal. And they acted various ways to reduce the number of loose stools. Patients who experience diarrhea should be instructed to stay hydrated with fluids such as water and electrolyte solutions.
Bismuth subsalicylate.
Has an infective and anti-secretory properties. It is a direct mucosal protective effect and weak in acid and inflammatory effects. Look at your side effects, things that can happen. Look at your cautions and contraindications, and then your interactions with the medications if you're taking this particular medication. Alright, with our opiate agonist, we have
Diphenoxylate with atropine.
and
Loperamide.
these products act by slowing intestinal motility, thus allowing for more reabsorption of fluid back into the body, therefore solidifying the feces. Your Lomotil is a product combining your,
Diphenoxylate with atropine.
it is a Schedule C4 controlled substance. Your,
Loperamide.
which is your Imodium, is available in various forms. All are over-the-counter products except for the ones that come in capsule formulations, and they still remain as prescription only. Look at your side effects of those. Look at your cautions and contraindications. You can see it on the screen. Let's talk about our probiotics. Our probiotics are living microorganisms that can alter a patient's intestinal flora and may provide benefit in numerous GI diseases. The body's naturally occurring gut flora may fall out of balance in a wide range of circumstances, including the use of antibiotics or other drugs. So sometimes if you drink excess alcohol, if you're under a lot of stress, if you have certain diseases, or if you're exposed to toxic substances. Okay, so what we're looking at is the difference between our H. pylori versus our C. diff infections. It gives you definitions of both. It tells you what the cause is, and it also tells you the treatment. Make sure we understand the difference in them. Antiflagellants are used in the symptomatic treatment of gastric, bloating, and post-operative gas pains by helping to break up gas bubbles in the GI tract. As you can see, there's no side effects noted. Look at your cautions and contraindications. And really, there's no interactions as well. Very simple. Cathartics and laxatives. Laxatives promote evacuation of the intestines and are used to treat the constipation. Our cathartics fall within a laxative category that are promoted rapid evacuation of the intestine and alteration of stool consistencies. Many over-the-counter laxatives are self-prescribed and overused by a large portion of our population. The prevention and relief of constipation is better achieved through natural methods like high-fiber diet, adequate fluid intake, good bowel habits, and exercising. Now, our bulk-forming laxative, which is also known as our fiber supplements, what it does is soften the stool by absorbing water and increase fecal mass to facilitate defecation. They are the treatment of choice for simple constipation unrelieved by natural methods. Your cautions are contraindication for bulk-forming laxatives applied to patients with acute abdominal pain, partial bowel obstruction, dysphagia, or esophageal obstruction. Our stool softeners are surface-acting agents that moisten stool through a detergent agent and are administered orally. The dosage required to soften stools varies widely depending on the condition and patient response. Stool softeners are the choice for pregnant or nursing women and children with hard, dry stools. Side effects are rare, with occasional mild transitory GI cramping or rash. Your cautions and contraindication apply to acute abdominal pain or prolonged use more than a week without medical supervision. Caution to avoid stool softeners that also contain stimulant laxatives, and there are your examples. Our next up is
emollients,
which promotes stool movement through the intestines by softening and coating the stool. Mineral oil may be administered orally and is usually effective in 6 to 8 hours. Mineral oil is sometimes administered rectally as an oil retention and enema. Your side effects of this could be seepage of oil from rectum causing anal irritation, malabsorption of vitamins A, D, E, and K, only when it's been used prolonged by oral use. Your cautions and contraindications include the children up to 5 years old or children under 5 years old, anybody that's bedridden, debilitated, or your geriatrics. Patients that has dysphagia, gastric retention, hiatal hernia, pregnancy, prolonged use, and if they're on as well on stool softeners. Your saline laxatives promote secretion of water into the intestinal lumen, which is the opening, and should be taken only infrequently in single doses. Your saline laxatives should not be taken on a regular or repeated basis unless directed by a physician. The onset of action is 0.5 to 3 hours. Side effects of saline laxatives used for prolonged periods are in overdoses can include electrolyte imbalances, CNS symptoms including weakness, sedation and confusion, anemia, cardiac, renal, and hepatic complications. Your cautions or contraindications apply to long-term use, heart failure, or other cardiac disease, edema, cirrhosis, and renal disorders, and those that are taking diuretics, acute abdominal pain, and colostomy. Our next is
cathartics,
and the laxatives. These are 3 more that is part of this category. Make sure to read them and know, be familiarized with them. So we talked about the 7 types of laxatives. What you're looking at on the screen is your 7 categories, and it also gives it in a shorter form the action that it promotes. Okay, so we're going to talk about your antiemetics, and they're used in prevention of treatment of nausea, vomiting, vertigo, or motion sickness. Our first one up is
anticholinergics,
which is usually used for motion sickness. If you look at the different specifications of medications, you see that you have Dramamine or scoplamine, and which are used for that. So it gives you the instructions for greatest effectiveness for the patch. They put it behind the ear. A lot of people use that when they go on cruises or flying before they're exposed to motion. Can't cut the patch because it has medication in it. And also affected up to 72 hours, so it'll last for 72 hours. But you can also take it orally 30 minutes before you're exposed. So it depends on which route. Now your next one is your anti-dopaminergics, and you see where what they're for and how they're used. If you also noticed, antagonism of the dopamine receptors in other areas of the brain, including those involved with movement, can lead to extrapyramidal reactions like your tremors, difficulty walking, and muscular rigidity. which are common for drugs in this class at high doses. And these are the two medications that you're seeing on the screen that cause that. Reglan is another good medicine that they use, and it helps. It is a antiemetic and a stimulant for of the upper GI motility, which helps accelerate gastric emptying and intestinal transit. Our next drug that falls under antiemetics is your serotonin receptor antagonist. It's the serotonin, which is a major neurotransmitter that is involved in emesis and is located in the gut. So, your serotonin receptor antagonist peripherally blocks the serotonin receptors found centrally in the CTZ and peripherally in the intestines to control the emesis. You can see the side effects that are there. There's quite a few of them. Look at the cautious and contraindications, which can include your children and adolescents. So a lot. I mean, it affects even your older adults. And then look at your interactions with the different medications. All right, so let's check your knowledge. Which is not one of the 8 GI medication categories? Look at your choices, write down your answers, and we'll check it at the end of the video. Check your knowledge. Which laxative moistens stool through a detergent action? Look at your choices, write down your answers, we'll check it at the end of the video. Let's check your knowledge. Which gastrointestinal and intestinal medication category does meclizine belong to? Look at your choices, write down your answers, and we'll check it at the end of the video. Alright, what's up now is the gastrointestinal drug patient education. One of our jobs as a certified medical assistant is to educate our patients, and we have to be proficient in our knowledge. So what you're going to be looking at in the next few minutes, is the medication categories, and then the important information or the important patient education that you need to know to be able to educate your patient. Take the time to pause it, write it down, because you need to know this. Check your knowledge. Which gastrointestinal drug categories should not be used if the patient is on CNS depressants or SSR antidepressants? Look at your choices, write down your answers, and check them at the end of the video. Check your knowledge. Due to a possible increase in toxins in the intestine, antidiarrheal and blank should be avoided in the treatment of C. diff. Look at your choices, write down your answers, and we'll check your answers at the end of the video. Alright, your self-assessment. See if you can answer these questions. What are the 7 types of laxative medications? What medications are used to treat H. pylori? Can you list the 8 gastrointestinal drug categories? Alright, here's the answer to your case study. See if you got it right. Here's the answer to check your knowledge activities. Pause the video, check your answers, and see. And if you didn't, go back and reference. If you didn't get the answer right, go back and references. Make sure you ask questions if you have any. Thank you.